Hello, my name is Sameh Gaballa. I'm an associate member at Moffitt Cancer Center. I'm one of the lymphoma faculty. And today at the American Society of Hematology 2024, I presented an oral abstract about AZD0486 in patients with relapsed refractory diffuse large B-cell lymphoma. So what that means is, AZD0486 is what we call a bispecific antibody. It's not chemotherapy, and it's an advanced immunotherapy. And basically what it is it's an antibody that has, two ends. One end attaches to T cells inside the patient's body, so they get the medication as through the intravenously through the vein. And basically the antibody, one end of it catches the T cells inside the body, and the other end attaches to the cancer cell. So it's basically hand-holding the patient's own T cells to go and kill the cancer cells. The things that are unique about this particular antibody is it targets a different target on the cancer cells other than what is currently approved. So at this time, we have some antibodies that are approved, glofitamab and epcoritamab. They're both bispecific antibodies, but they target what we call CD20. This particular bispecific antibody that I presented targets a different antigen called CD19. So it's just a different, it's attacking the cancer cells from a different angle. This is, again, a first-in-human, a phase 1 study, so it's a relatively early data that we're presenting, and it's mainly focusing on safety and also looking at the effectiveness, but it's mostly focused on effectiveness. All bispecific antibodies, they have what we call CRS, cytokine release syndrome, or ICANS, which is neurotoxicity, and these are side effects that are common to immunotherapies like other CAR T-cell therapies or other bispecific antibodies, and there are side effects that have to do with activating the immune cells. When the immune system is activated, because the T cells are basically going in and trying to fight the cancer cells and kill them, they produce inflammation in the body. And this inflammation could be, the patient's basically going to feel as if they're sick, like, they might feel as if they have a flu. So a fever, body aches, fatigue, not because they have an actual infection, but it's because their own immune system is actually fighting the cancer cells. So these, the cytokine release syndrome can be mild, meaning, fatigue or fevers, or, if it gets severe, then the blood pressure could drop or the oxygen levels could drop. And what we showed with the trial was with our, gradual dosing schema, all patients basically had what we call low-grade CRS. So it was mostly fevers, and there was no severe cytokine release syndromes that have to do with organ toxicity or dropping the blood pressure, for example. So that was one. The other toxicity that we can sometimes see with all of these immune therapies is what we call ICANS, or neurotoxicity. And what that means is neurological toxicity. So patients could have, some confusion or tremors, or, they're unable to articulate things. And the neurotoxicity seen on the trial was, again, mostly low grade. It happened typically for about a day. Some patients had it for up to 4 days, but it was reversible in all patients, and it was low grade. In terms of the effectiveness of the treatment, so we did see that we had responses in a lot of patients, including patients who had failed CAR T-cell therapy, which is, our most potent treatment for diffuse large B-cell lymphoma. And also patients on this study responded even though they had failed other bispecific antibodies that were targeting a different antigen. So this is a treatment that can potentially offer treatment options for patients who have failed other therapies, including chemotherapy, immunotherapy, CAR T-cell therapy, or bispecific antibodies, and we're very excited about it. Again, this is a first-in-human, a phase 1 study, and we're still in the process of developing this agent and looking at higher doses, trying to achieve higher effectiveness in this very difficult-to-treat patient population.